There we go. Sorry about that. Once again, I want to thank each of you for your, not just for your testimony today, but for all the work that you have done over this entire, and it is a campaign. It's very similar to a war. We're seeing a COVID surge right now in Colorado that has led to emergency capacity issues in our hospitals, and that's not just in certain parts, it's pretty much across the state. Just about 80% of those in the hospitals are unvaccinated. And Dr. Fauci, I guess my first question would be, in a state like Colorado where we have made real progress, I mean, great strides in vaccination rates, how should we be thinking about this recent surge? Just that it's still the tail of the unvaccinated?
Yeah. That is not unexpected when you get into, for example, the situation where the weather starts to get colder and people do things more indoor. But as you said quite correctly, when you see surges, they are very, very heavily weighted towards the unvaccinated, not only in the incidence of infection, but also in the incidence of severe disease that might lead to hospitalization. I believe that's a pretty obvious type of an explanation for that, which is the reason why we continue to push to get as many people vaccinated as we possibly can.
Right. And Dr. Walensky, I thought that Senator Romney's comments about his children and grandchildren, and I think soon, if not already, his great-grandchildren, that is an issue. That's what we're seeing more questions every day. And so this week's vaccine approval for 5 to 11-year-olds, I think one question we've heard is how is that going to affect this increase in infection rates? And how are we going to be? How do we do everything we can to make sure these kids get vaccinated? Those who want to be vaccinated.
Yeah, so thank you, Senator. First, let me go back to Senator Romney's question on percent of children who get long COVID. We've had about 1.9 million children between the ages of 5 to 11. We've seen a long COVID rate in those children of about 4.5%. It's less than adults, but it's still high, and we should note it. We've also seen in that demographic 5,000 cases of MIS-C, that's multi-system inflammatory syndrome, that can be devastating. We've had 46 deaths from MIS-C alone, and nearly 100 children in the demographic between ages 5 to 11. We have a lot of work to do to reach out to our pediatricians, to reach out to our parents, to make sure that we have the communication, the education, the information that parents need. This is a new vaccine to them. They perhaps received the same Pfizer vaccine themselves, but for their children, it's a new vaccine. One thing I think is really important and is probably worth grounding people on is we have a lot of vaccine preventable diseases for our children now. Varicella, hepatitis A, meningococcus, just to name a few. The death rates from varicella are about 16 per year before vaccination. For hepatitis A, about 3 per year. For meningococcus, about 8 per year. The death rate for COVID in this age demographic was 66.
Wow, very sobering. And I am fully aware of the high levels of unvaccinated kids in certain, especially in certain geographic areas. My son, Teddy, who's now off at college, but when he had just turned 4 months, he was about to get his second whooping cough shot, and he got infected by a unvaccinated kid who it's about the most terrified, it's the most terrifying experience I think I've ever been in, where you just can't stop him from coughing, and you're in a hospital and you have to blow oxygen on his face to try and just shake him out of the coughing. It's absolutely terrifying. And it was amazing. It took us a long time to get a doctor to diagnose it, because at that point we were just beginning to see whooping cough again, because everyone had was in the habit of getting their children vaccinated, and suddenly that changed. Ms. O'Connell, I also worry that the recent surge is further stretching the situations around our frontline workers. After already the last couple of years tremendously difficult. We hear that in Colorado, and is that happening across the country as well?
Senator, yes, thank you for that question. We have sent 27 different teams out to augment hospitals that were overrun by COVID patients, about 600 team members to 12 different states. So we are seeing that.
Great. And how do we address burnout among healthcare workers? What advice can you provide?
Well, we've been happy, of course, to go in and help where we can, but we know that we're not the sustainment. One of the things that the American Rescue Plan provided was funding for the public health workforce. And so we're continuing to look for ways to invest in a long-term public health workforce to support these first responders and healthcare workers that are burned out and worn out from this pandemic.
Wow. And again, I'll just finish by saying thank you to each of you. One of the most amazing things to me is, as a scientist who recognizes the importance of data, that your ability and your vision to start collecting data from the very beginning and make sure that we take the lessons that we learn in this situation where so often people are making decisions without enough data is really going to inform our pandemic preparedness and help this, not just our country, but the world as we go forward and battle not just this virus, but the others to come. Thank you.
Thank you.
Yield back.